Legislation will soon be introduced to establish the Universal Health Coverage (UHC) program. In 2024, the Health Ministry expanded the Universal Health Coverage Initiative to include maternal and child screening, snakebite treatments, and prostate cancer services. Breast cancer, diabetes, and hypertension screenings are set to be added to the service offerings this year. Prime Minister Pierre disclosed that the legislation will make the UHC a separate entity to administer the initiative.
Mr. Speaker, we take the health of the people of St. Lucia seriously. Unlike the former administration, we do not speak about an elusive health insurance that has shown absolutely no results, either on paper or otherwise. This year, the government of St. Lucia will introduce legislation that will bring universal health coverage into existence as a separate entity to finance and administer the UHC program.
Meanwhile, construction on St. Jude Hospital is to be completed by year's end, which will also signal the start of work to rehabilitate the George Odlum Stadium into a world-class sporting facility.
The St. Jude Hospital has been developed to meet international healthcare infrastructure standards with an emphasis on durability, energy, efficiency, and climate resilience across all buildings. Preparation for transition from the functioning St. Jude Hospital at the stadium to the new facility is on the way. Finance for the transition team has been provided in the estimates, and the commissioning has commenced. This time, Mr. Speaker, there has been consultation with all stakeholders of the facility. To ensure the adoption of global standards for operating the new facility, we have engaged Accreditation Canada. Mr. Speaker, the local contractor has assured me that work at the hospital will be completed this year. The rehabilitation of the George Odlum Stadium is linked to the completion of the St. Jude Hospital rehabilitation project for two reasons. Firstly, the stadium has been home of the St. Jude Hospital since the devastating fire in 2009 and must be vacated.
The government will also seek to strengthen healthcare services by upgrading several healthcare facilities. Construction on the Martin Didier Polyclinic is ongoing with the goal of making it a 24-hour medical facility.
Work will continue preparing our wellness centers for advanced climate events. Several wellness centers will be renovated to become climate smart. The former Victoria Hospital, now the Sir Winston C. Paris Medical Complex, houses the Betty Wells Urban Polyclinic, the Cuban Eye Care Clinic, and urgent care services. Expansion of the Dr. Martin Didier Polyclinic at Grosile is ongoing, which will lead to the polyclinic becoming a 24-hour facility.
The Pierre administration will also offer permanent employment to nurses who have completed their training and upon satisfactory completion of 2 years of employment. Additionally, the government will invest in nurses attending the Sir Arthur Lewis Community College to assist with the supply of nurses. For the academic year commencing September 2025, first-year and second-year nursing students will receive $2,500 in tuition support. Third-year nursing students will receive $5,000 in tuition support, and final-year nursing students will receive $10,000 in tuition support, covering full tuition payment. Gina Filippi, HTS News Force.